Crimean Congo hemorrhagic fever is endemic to regions in Africa, the Balkans, the Middle East, and Asia. Since its discovery, it has spread to more than 30 countries and has been identified as the culprit of numerous regional outbreaks with a case fatality rate of up to 40%. The virus is characterized as a high priority pathogen by the World Health Organization. If you plan to travel to endemic regions, it is imperative to educate yourself about this deadly disease to lower your risk of infection. Cchfv is an enveloped, single-stranded, negative-sense RNA virus. The natural cycle of the virus involves both domesticated and wild animals as hosts, and its main form of transmission is through bont-legged ticks, which act as both a reservoir and a vector. When an infected tick feeds on a wild or domesticated animal, the virus spreads through the tick's saliva. The animal can then serve as an amplifying host for the virus, spreading the virus to non-infected ticks that feed on the infected animal. When an infected tick bites a human, the virus is able to bypass the innate defense of the epithelium. Upon entry into the host, Cchfv targets various cell types. Specialized glycoproteins on its surface facilitate attachment to host cells. The virus then enters the host cells via receptor-mediated endocytosis. The viral genome is released into the cytoplasm to serve as a template for viral RNA synthesis, leading to its replication within the host. In response to infection, the host's innate cells will initiate a systemic inflammatory response, initially leading to flu-like symptoms such as fever, headache, and lethargy. The disease can progress as the virus spreads and affects more parts of the body, causing more severe symptoms. While the dissemination route is not exactly known, it is hypothesized that the tick bite can give direct entry into the vascular system, allowing the virus to spread through the bloodstream. Through the vascular system, the virus can spread systemically to the spleen, liver, lungs, kidneys, and brain. The main clinical characteristics, such as hemorrhage and increased vascular permeability, indicate that endothelial cells are the primary target of Cchfv. By infecting and damaging more endothelial cells throughout the body, the integrity and function of blood vessels begin to fail, leading to increased vascular permeability, leakage, and compromised blood flow. Cchfv infection is also strongly associated with the failure of multiple organs in severe cases. Dissemination of the virus can elicit uncontrolled and harmful inflammatory responses. In several studies, high serum levels of the pro-inflammatory cytokines IL-6, IL-8, IL-10, and TNF-alpha were implicated as prognostic factors showing disease severity in Cchfv patients. The virus has several mechanisms to evade immune responses. One mechanism involves the inhibition of interferons, which play a role in alerting neighboring cells to the presence of a virus. By inhibiting interferons, Cchfv is able to dampen the host's immune response. You do not need to be bitten to contract this virus. Direct contact with the blood, tissues, or bodily fluids of infected animals can still lead to infection. Animals do not manifest any hemorrhagic fever symptoms despite being contagious. And the majority of cases have occurred in people in the livestock industry, such as agriculture or slaughterhouse workers. Healthcare workers who care for patients with suspected or confirmed CCHF are also at high risk. Although there are currently no vaccines to protect against CCHIV in humans nor animals, there are preventative measures that you can take to lower your risk of infection in endemic areas. Number 1 is to reduce the risk of tick to human transmission by wearing protective clothing and using bug repellent. Number 2, reduce the risk of animal to human transmission by limiting unprotected exposure to wild and domesticated animals by wearing protective clothing and gloves when handling animals. Lastly, reduce the risk of community-acquired transmissions by utilizing proper sanitation techniques, such as washing your hands regularly.